afternoon. I would like to take a moment to welcome you all here today. My name is Jennifer Cameron, and today I'll be talking to you about naturopathy, its principles and practices, and also what is involved in the appointment and treatment processes. So what is naturopathy? Well, naturopathy encompasses a number of modalities. Some of the various tools that we can use include herbal medicine. The advantages of herbal medicine is that it's a very individualized medicine. Herbs work by rebuilding and retraining a various system if there has been a deficiency. So let's say you have been really stressed and you're really depleted and exhausted. We have a whole class of herbal medicines called adaptogens and adrenal restoratives. What they do is help the body rebuild and help the body cope with stress more. From a nutritional perspective, we can use both diet and supplementation. And nutrition is very much the framework of how naturopathy works as well. Basically, every pathway in the body, every process in the body consists of a biochemical equation or biochemical reaction. With that particular equation, the nutrients are required in each and every step of the way. So a naturopath can use various nutrients and prescribe them to rectify and normalise those particular pathways. Or they can rely on diet, but that generally takes a little bit longer. Obviously, that's lifelong changes, whereas a nutritional supplement can be prescribed at the appropriate dose for generally about 3 to 4 months, and actually can normalise and improve a specific deficiency. Other modalities that we may use include things like iridology, flower essences, and homeopathy as well. This is the job of a naturopath. Yes, we treat the symptoms, but we also treat the cause. Our ultimate goal is not just to make the sick better, but also educate them and give them the way and means to help themselves. This is because all naturopaths run under the 6 basic principles and code of ethics. The 6 principles are: 1. The healing power of nature. It's a naturopath's role to support and facilitate nature's healing power. 2. Identification and treatment. To not only treat the symptoms, but also treat the cause. 3. First, do no harm. To avoid suppressing symptoms. This would interfere with the healing process. 4. The practitioner as teacher. To educate the patient and give them self-responsibility for their health. 5. Treat the whole person. Disease happens as a response to bodily toxins and imbalances in a person's social, physical and spiritual environment. When the body is weakened, it gets sick from the parasites taking advantage of the weakened state. And finally, 6. Prevention. And I'll reiterate. 6. Prevention. This is accomplished with education, healthy living, and addressing any risk factors that may be present. And on to the appointment procedure. To make the appointment, you will need to either ring or come into the office to book the time with the naturopath, because naturopaths are becoming more and more sought after. Don't be surprised if you have to wait a few days or even a few weeks to see the naturopath. While talking to the receptionist, he or she will advise you on what exactly you will need to bring along with you to the initial appointment. These things can include X-rays, CT scans, blood results, relevant doctor information, and a list of any prescription or other drugs you are currently taking. The receptionist will also advise you of the cancellation policies, which usually state that you must give 24 to 48 hours notice if you cannot make the appointment. Depending on the establishment, if you do not allow this time, they can charge you a cancellation fee due to lost revenue. Each consultation will be a little bit different. Generally what happens is that the consultation will go for between an hour to an hour and a half for your first consult. Follow-ups are usually between 30 to 45 minutes, depending on the practitioner. The naturopath will ask you about your diet, your lifestyle, each of your body systems, and any symptoms that you present with, and any areas that are of concern. Everything makes sense and means something. The role of the naturopath is literally to piece together the pieces of your jigsaw puzzle and come up with a picture of what's going on with your health. Now, the naturopath will set up your own personal file, and all information gathered during the appointment will be placed into that file. No one but the naturopath is allowed to cite this information, as this will result in a breach of the Privacy and Confidentiality Act. If at any time the patient requires the release of this information, they would have to sign all required release forms. This is to safeguard not only the patient, but also the naturopath. With all relevant information gathered, the naturopath can now start developing and implementing your treatment plan. This can include a new dietary plan, medication, exercise, and even further tests depending on the nature of your affliction. Literally, anything that you see your general family physician for, you could see a naturopath for. We can treat anything and any ailment within the body. We can support the patient for it. Naturopathy has its greatest foray when it helps you with a specific condition that the medical modal doesn't really have a solution for. So, for example, maybe there's an unexplained infertility issue. Maybe you have PMS. Maybe you can't sleep at night. Or maybe you just are currently going under a lot of stress. All of these things, the medical modal, unfortunately, don't have very good answers for. And they just say, just give it time. The naturopath can usually understand what's going on. And perhaps there's a strong nutritional deficiency. Or perhaps your body has just been through a lot of stress and you need to retrain and rebuild it. Either way, they can usually find the answers for you and help you actually find greater levels of health. During the treatment process, the naturopath is not only your medical advisor, but also your friend. They are there to help you through the whole process. At the end of your treatment, you should feel healthier and have more energy and a better outlook on all aspects of your life. So what should you look for when you're searching for a good practitioner? A good practitioner, well, probably the easiest way is to make sure they have the appropriate qualifications. The general public, ascertaining and understanding what this is, can be a bit tricky. But the easiest way to do that is to make sure they have membership with a professional association. The main three bodies within Australia include NHAA, ATMS, and ANTA. If they have membership within the association, it means that you'll be able to get health fund rebates depending on your level of cover. It means they will have professional indemnity insurance, so you know they are appropriately prepared and skilled for all those sorts of good things. But most importantly, it means they have had the required education necessary. So by having membership, it means that you know you're getting someone that hasn't just done a weekend course. It means that you're getting someone and you're guaranteed that this person has done a minimum of 3 to 4 years of undergraduate training or even more. Thank you for listening. Have you got any questions?